Hello, my name is Missy DePrano, and today I will be presenting on vaccine management and standardization driven by frontline caregivers. Vaccine-related errors were the most highly reported area of preventable patient harm within our medical group. We realized that the existing hierarchical leadership model that was in place really prevented the frontline clinical staff from being empowered to make needed practice changes. The purpose of this project was to really take a deep dive look at our vaccine-related errors and determine what we could do as a medical group to prevent them from happening in the future. And our answer was standardization and utilizing a shared governance model to do so, which would really engage those frontline caregivers. So how did we get there? First, a vaccine quality council consisting of frontline caregivers and encompassing both primary care and specialty care clinics were formed, and the frontline staff really owned this initiative. We began to take a deep dive look at the types of vaccine-related errors that we were experiencing, and then looked at what we could do as a medical group to prevent them from happening in the future. We developed a formal standardized vaccine process encompassing every aspect of vaccine administration and involved every clinic in the medical group that administered vaccines. So by empowering our frontline caregivers to make needed practice changes, we also saw increased caregiver satisfaction and caregivers really working at the top of their licensure. Our Vaccine Quality Council was able to standardize the vaccine process from top to bottom. We implemented a color coding system to differentiate between vaccines that were supplied by the Vaccines for Children program from our clinic stocked vaccines. The refrigerator setup is the same for every clinic, with color-coded bins that the vaccines are stored in, the tags that are used for each individual vaccine, and even down to which shelf vaccines would be placed on, making sure to separate the vaccine stocks as well as separating look-alike, sound-alike vaccines. We agreed upon standard job aids that are posted in every medication room to provide all information that a caregiver might need in order to administer any vaccine. And finally, we implemented an independent verification process or a peer check that is required prior to administering any vaccine. So no matter what clinic you're working in, the vaccine storage and administration process should look exactly the same. We saw some pretty amazing results from this initiative. The first thing we saw was our frontline caregivers really owning their vaccine practice and taking an active part in implementing evidence-based practices. Additionally, we implemented top of licensure evidence-based vaccine protocols that all caregivers, including medical assistants, could work from. This is helping to increase efficiency as well as offloading provider burden. And perhaps my favorite outcome from this project is that by standardizing our vaccine process, we saw a 45% decrease in vaccine-related errors, as well as a 2.4% increase in our vaccine compliance rate across our medical group. It's been a long and tedious journey to get to the huge reduction in errors, but our hard work has paid off. We're continuing in this journey and strive to see zero errors related to vaccines in our medical group. Thank you so much for allowing me to share our work with you today.